So here's a crazy thought, but were doctors trained wrong? Now, before other doctors start to comment or patients panic, I don't mean were we trained badly. We were trained incredibly well and thoroughly. However, I don't know if my training really prepared me for modern day healthcare. See, here's the problem. Medical training is incredibly broad. It covers a lot of areas. It's very thorough. However, most of medicine these days is incredibly specialized and niche. You might notice there's not only just an orthopedic doctor, there's an orthopedic doctor subspecialized in hand surgery. Or if you need to see someone for a certain issue, now you mostly see specialists because the primary doctor, even if they have the knowledge to address one of your issues, they don't have the time anymore. They have 10, 15 minutes. They have to refer you. So now everything's specialized. Even for general care, you get admitted to a hospital now, you see a hospitalist doctor. You don't see your primary who rounds on you in the hospital. You just see the hospitalist who only works in the hospital. And when you're discharged, you see your primary. And my training, on the other hand, prepared me to do all of it, but I don't use most of it. My training basically was pre-med years where I learned cellular molecular biology because I have an undergrad in biochemistry, and then the early part of med school was all basic sciences and understanding the Krebs cycle and the organ systems and all these nitty-gritty things. Then third and fourth year, I spent weeks and weeks with each specialty. I was delivering babies, scrubbed into surgical cases. I was doing adult internal medicine, anything and everything I was learning along with pediatrics. And then residency, when I specialized in pediatrics, it was still pretty broad because I was spending months working in the pediatric ICU, the neonatal ICU, the pediatric emergency room, not just outpatient general pediatrics. And then when I finished that, I got my job and now I do outpatient general pediatrics, but that's all I do. And I've even reached out about, doing hospital work, but they don't want to take someone who's only outpatient. They want a hospitalist for that role. And certainly I can't scrub in and do surgical cases. So it just makes me wonder, what was the point of that entire breadth of training if I was only going to use maybe 5 to 10% of it in my day-to-day job? Now, one benefit, I will say this, is that when I refer patients out, I know who to refer to because I've experienced most of the other specialties. I know the right place to send a patient, or if they get admitted to the hospital, I know exactly what they're in for. I can explain to the patient what they're going to do, and when they're discharged, I can understand the whole discharge summary and communicate with the hospitalist very fluently because I've done that. So it's not a total waste, but I do wonder if there was a more efficient way to have trained me for what I'm doing. Those 7 years I spent in med school and residency, if that was spent hyper focusing on outpatient general pediatrics only and really learning my area well, would I have been a better doctor today? It's a question to ask.